At University of Virginia Health System, we're for bringing advanced care closer to home. So we're bringing health knowledge directly to you with UVA Health System Radio. Here's Melanie Cole.
Heart conditions run in some families, and genetic testing may help family members better understand their risk for hereditary heart conditions. My guest today is Matthew Thomas. He's a genetics counselor at UVA Cardiovascular Genetics Clinic. Welcome to the show, Matthew. So let's talk about genetics and heart disease. How would someone know if they are at risk for an inherited heart disease?
Oh, Melanie, thank you for having me. Someone would know if they're at risk for an inherited heart disease if there is a pattern of the disease in their family. What you tend to see with heart conditions that are genetic are people that get diagnosed with certain heart problems, like enlarged hearts or cardiomyopathies, or heart rhythm disorders, arrhythmias, at younger ages than you would expect. The thing that stands out about inherited heart diseases is they're caused by a gene or genes that are faulty, that you're just born with, that may be running in your family for generations. It's not the result of poor diet or lack of exercise. It's a genetic predisposition that you have. And some clues that you would see, aside from an early age of diagnosis, are someone in the family passing away suddenly and unexpectedly at an age younger than would be expected, so say less than 50 years old. Those are a couple of things that stand out.
What would somebody do if they find out that their family members, immediate family members, have had heart disease problems before? What would you advise be their first thing that they should do?
So if a patient or a person out there is concerned that they may have an inherited heart condition in their family, the most useful thing that they can do is just gather their family history. So talking with siblings or parents, grandparents, aunts, uncles, to find out, if there was somebody who passed away suddenly at a young age, what were the circumstances behind that? Was there ever a diagnosis? One thing I commonly see when I meet with patients is that people commonly refer to any death that happens suddenly as a heart attack. And what it turns out is, oftentimes that heart attack may have actually been a typical heart attack that many people can have, but there are also heart issues, cardiac arrest that can be caused by an electrical problem with the heart or a structural problem that has nothing to do with the typical risk that you would get, again, from diet and exercise-related concerns. So collecting the family history would be step one. And then if the patient has a concern, sharing that information with their primary care doctor. And you can even directly call a cardiovascular genetics provider to find out, okay, is this a good reason to come in for a concern? Is there something that you might be able to help me with?
So what can someone expect when they're getting a genetic test for heart conditions? And does the genetic test tell you anything about, their lifestyle risk for heart disease?
Genetic testing has some good values for people that are concerned about their risk for having a heart condition that's running in their family. Occasionally, we are able to find a test result that explains exactly why somebody has a given heart condition. So, for example, if somebody comes to our clinic with a genetic heart condition called hypertrophic cardiomyopathy, where a portion of the heart is thicker and it can lead to certain problems with how the heart pumps and some of the electrical signals in the heart, we can do a very cutting-edge, state-of-the-art test, the genetic test, on a blood sample to find the gene that's responsible for that patient's heart problem. And then that test can then be used for other people in the family. So if a mother comes to see me and she has, children that are about to start playing sports in high school and she wants to know, I have hypertrophic cardiomyopathy. Are my children at risk? Is it safe for them to play sports? By finding the gene in the mom, we would have the ability to then know whether the children may carry the gene or not, and that would determine what their risk is for having that disease. If we find the gene in one of their children, then they may receive some restrictions in their exercise, actually. For some people, it's not safe to be in competitive sports when you have these heart conditions because it puts you at risk. But on the other hand, if they're negative for the gene, that means that they're going to likely be cleared to play with no restrictions whatsoever, and it's greatly reassuring to the athlete and the family.
Besides blood tests, Matthew, what other type of tests do you do for genetic counseling?
So I work as a team, as a part of a team here, and what we typically do is a combination of genetic testing when indicated and cardiology screening. So if genetic testing doesn't provide an answer, but we still believe a patient has an inherited heart condition, then we rely on cardiology testing, and that would be things like an echocardiogram or an ultrasound of the heart, or an EKG, which is looking at the heart rhythm. Sometimes we do exercise testing and other sorts of heart studies that are not invasive, but they give us a good picture of the heart and its health. And that gives us reassurance when you know there's a pattern of disease in the family when you examine somebody with good cardiology testing and interpreted by a cardiologist to determine if they're at current risk and whether that needs to be repeated again as the person gets older.
So what's your role within the Cardiovascular Genetics Clinic?
So I'm a genetic counselor. I work exclusively with cardiovascular disorders, and my role is to do two things. One is to identify patients that are at high risk for or have an inherited heart condition and offer them genetic testing that's indicated based on their condition. And the second thing is to get the word out to family. So even though I may be meeting with one patient in an afternoon, or one patient per hour slot, I help reach the family members that aren't in the room to make sure they know that they could be at risk for the same thing, and they can get protected by close cardiology screening. And so I basically work with them to offer genetic testing and then get the word out to family.
If someone gets a positive test result, Matthew, does that mean they're a ticking time bomb? Does that mean that they will necessarily have one of these types of genetic heart disease, or are there things they can do to change the outcome?
Fortunately, inherited heart conditions are very responsive to treatment. We may not be able to prevent problems from happening in some people, but we can certainly prevent usually the more serious complications like a cardiac arrest, and that requires early identification of the disease, and that's what's critical with these conditions. What we want to avoid is somebody who is at risk for a serious inherited heart condition that predisposes to cardiac arrest from not being aware of it, not receiving necessary medicine, or receiving necessary surveillance to make sure that if they needed to have a procedure done to protect them, that they don't miss that opportunity. So fortunately, we don't, we feel very positive when we can diagnose a patient with a positive result that we can take good care of them to protect them from serious complications. I mean, each disorder is very unique in the way that it affects somebody, but we are in general very positive about our ability to make sure that we can prevent really serious events from happening in someone.
And why should patients come to UVA to address their concerns about inherited heart disease, Matthew?
Well, at the University of Virginia, we have a multidisciplinary team. I'm a member of that team as the genetic counselor. We have cardiologists that specialize in electrophysiology or heart rhythm, congenital heart diseases, sports cardiology. We have specialists that emphasize heart failure, enlargement of the heart, or cardiomyopathy. So whatever the individual condition is that's running in a family, we have the expertise here to take good care. We all work together to help both patients and their family members who have these conditions, and as a team to make sure that we're providing the optimal service for the entire family who comes here. And, this doesn't happen in a vacuum. You mentioned the idea of this being for some people, when's the next shoe going to drop, or what could happen next, and we provide as much support as necessary to make sure that when we make these diagnoses, the patients feel that they get the support that they need to live the most fulfilling and active lives that they possibly can.
Thank you so much, Matthew. And for more information on the Genetics Clinic at UVA, you can go to uvahealth.com. That's uvahealth.com. You're listening to UVA Health Systems Radio. This is Melanie Cole. Have a great day.